It's happened again, you think. That slight tickle you felt last night in your throat has erupted into dry eyes, a cough, body aches, sneezing, stuffy nose, and daggers in your throat. You have to call off work now and waste the day away in bed hoping something, anything, helps you feel better. You pillage your bathroom cabinet. You find some Tylenol and some old cough syrup and take some, hoping it will help with the body aches. You head downstairs to the kitchen where an assortment of supplements and vitamins await you. Vitamin C, zinc, ginger root extract, the list goes on. You really have no idea what these do, but you take some of them anyways, hoping they will help. You get some water, head back to bed, and try to sleep this cold off. We've all been in these shoes before, and getting sick with the cold, the flu, or COVID can be rather dreadful for a few days. This is Health Reframed, where we simplify the science of health, break down complex medical concepts, and explore how we can reframe our approach to wellness, focusing on prevention, education, and systemic improvements that empower people to live healthier lives. My name is Jack Snyder. I am a prospective medical student wanting to be a doctor, and I have my degree in biomedical sciences with a concentration in anatomy and physiology. I'm also an EMT and have worked in healthcare for around 4 years now. Today, we're going to discuss the ways your body fights off a cold, what you can do to reduce your chances of getting a cold, and what supplements or medications, if any, actually work. The cold is a term thrown around to describe really any sickness that affects your sinuses, throat, nose, and windpipe. The cold is usually harmless and generally resolves in a few days or weeks. Furthermore, the flu and COVID normally present in similar ways to the common cold. Because of this, there is really no way of knowing what you have without getting tested by a doctor or by buying a test at the store. However, if you do get tested and are negative for COVID and the flu, as well as bacterial infections like strep throat, you probably have a cold. But what exactly is the cold? The cold is a virus, just like the COVID or flu, normally a rhinovirus or some other virus. The big difference here being that the COVID and flu have different viruses, COVID being the coronavirus and the flu being influenza. So what exactly is a virus? A virus is a small agent that infects cells in your body. I say agent because a virus is actually not alive at all. It can't live on its own and must infect a host to reproduce. A virus will go into your body's cells and reproduce, making more viruses, killing the host cell in the process. Viruses are very, very small and very simple. They contain but a few simple proteins that encase them and their genetic material that they use to hijack the host. Paradoxically, because of their relative simplicity, they can be rather difficult to target with drugs. Consider bacteria, for instance. Bacteria, unlike viruses, are actually alive. They can reproduce on their own and do not need a host. They are far more complicated than viruses and have a great deal of proteins and internal machinery that they use to stay alive. Because of this, we're able to target different parts of the bacteria with antibiotics. We can disable or attack different things in the bacteria, which make it unable to stay alive, so it dies. Different antibiotics work differently, targeting different things inside of the bacteria, but they all work to either kill the bacteria outright or make it so that the bacteria isn't able to continue living, disabling certain things that keep it alive or reproduce. This is something that is very important to understand because this means that antibiotics do not work against viruses. I'll say that again. Antibiotics do not work against viruses. They only work against bacteria. This is why if you have a cold or the flu or COVID, you can't get antibiotics because they don't work. Many of you may have had the experience of going to a doctor and them telling you you have a cold and perhaps you wanted antibiotics and they were like, no, we can't give them to you. And perhaps you didn't understand why particularly, but this is the reason. Antibiotics don't work against viruses, only bacteria. Unfortunately, many medical practitioners do cave in and prescribe antibiotics when they are not needed, and this can actually lead to bacteria which are antibiotic resistant. The way this works is if you give antibiotics to a lot of people, then the bacteria are able to mutate and change to be able to resist the antibiotics, and then the antibiotics don't become effective against the bacteria. This is a pretty big issue in medicine because Antibiotics are really useful. We do have many bacterial infections that are dangerous, so we want to be able to continue to treat them with antibiotics. But if we keep prescribing antibiotics, we get so-called superbugs, which are resistant to antibiotics. So I'll leave it at this. If you have a cold or a viral infection, you don't need antibiotics, and they won't help you, so don't ask for them. You may have a bacterial infection such as pneumonia or strep throat as a complication, and if you do, the doctor can test for this, and they would give you antibiotics. But if it's just a cold, just a virus, no antibiotics are needed. Anyways, back to viruses. Viruses that cause respiratory infections, which include the common cold, the flu, and COVID, have multiple ways of actually infecting you. The two main ways that they infect you is that they can contaminate surfaces that you touch, or they can be airborne. In other words, they can land on a surface, like a doorknob. Then if you touch the surface and then touch your mouth or nose, the virus can enter your nose or mouth or whatever else and get into your respiratory system, which would be your nose, your airways, your lungs, and it can infect those. Your sinuses, throat, lungs, and airways are all very good targets for viruses and bacteria alike because they are moist and exposed, which means that they can get in there easily, relatively easily, and they provide a pretty good environment for viruses and bacteria to grow and reproduce and take over your cells, pretty much. Viruses can also be airborne, which means that they can be traveling in the air. They can be in the air that you breathe, and if they get into your nose or your lungs or throat or any of that, they can infect you and cause you to get sick. So if someone sneezes, for instance, in the same room as you, the virus could get aerosolized. It can become floating in the air, if you want to think of it like that, and then you breathe it in, and then you get infected, you get sick, yada, yada, yada. An important tangent here is that if you're feeling sick and are progressively getting worse, like I mentioned earlier, testing is important. The cold is normally harmless and generally resolves itself unless you have other comorbidities, which we'll talk about in a minute. However, if you do in fact have a bacterial infection like pneumonia or strep throat, both of which again are bacteria, not viruses, you will need to get antibiotics because the antibiotics will actually kill the bacteria that cause strep throat or pneumonia. Furthermore, getting tested for COVID and the flu can help you narrow it down. We do have a couple medications for those. Generally, they're a little trickier to get. You need to have certain comorbidities. You need to be a certain age, that sort of thing. So getting tested for those can possibly make those options viable for you. But if you're negative for COVID and the flu and negative for all the other bacterial upper respiratory bugs, then you probably just have a cold, and that's probably what the doctor will tell you. And no antibiotics, no prescription drugs, and you're kind of left to your own devices at that point, unfortunately. So if that is you, how does your body resolve itself? Often the doctor will tell you, all right, do this, that, and the other. It'll resolve itself after a few days, few weeks. The answer lies in your body's built-in defense system, the immune system, as many of you will have heard of it. So the first part of the immune system that protects you is the natural barriers you have to viruses or anything outside of your body. This is kind of simple stuff that your body does to protect itself. Your skin, the acid in your stomach, mucus secretions all act to protect you from foreign invaders. These are the first line of defense in the body, and they actually work remarkably well considering how many viruses and bacteria we likely encounter every single day. However, sometimes a virus will get past this, in which case we have another system, another arm of the immune system, if you will, the adaptive immune system, so named because it adapts to whatever invader has entered your system. Let me explain. The adaptive immune system is rather complicated, and what we know about it has been a relatively recent endeavor. But here's the gist of how it works. In your blood, you have red blood cells, which many of you will have heard of, and these guys carry oxygen to all the cells in your body. Oxygen is very important. We've talked about it in a couple other episodes. But you also have white blood cells, which are part of the immune system. There are many, many types of white blood cells and immune cells, but I will simplify it somewhat and only talk about a couple of them to make it more digestible. The first challenge your body faces during an infection is actually identifying the invader. Your body has to be able to distinguish between the virus and your own body, because if it goes after your own body, that's no good. Your immune system can sense that something is wrong because you have damage in your nose, throat, respiratory system from the virus, but it doesn't immediately know the cause or just what is doing it. To solve this, specialized immune cells called macrophages engulf the viruses. They pretty much eat them and break them down into a bunch of little parts. They then display the fragments of the virus, these are called antigens, a little fragment, a little piece of the virus, to two different types of immune cells, B cells and T cells. So again, you have macrophages, they eat the virus, they break it down, and they're able to present, like on a silver platter, a piece of the virus called an antigen to B cells and T cells. Every B cell and T cell is unique. They reproduce or they multiply, and each one is going to be a little bit different. And each one is going to have a different receptor that may or may not recognize the viral fragment. Most of them won't actually recognize it, but a few will. The B cells and T cells that successfully bind to the antigen become activated and start multiplying rapidly. They're able to identify it, so they actually have specialized defenses against that specific virus, so you're going to want a lot more of these. This process ensures that the immune system produces enough cells specifically designed to fight that particular virus. B cells play a very crucial role by producing antibodies, which are a specialized protein that binds to the virus, marking it for destruction. However, not all B cells produce the same antibodies. Each one is tailored to recognize a specific pathogen. Like I said earlier, they're all different. They all have different receptors that identify different antigens, and they all produce different antibodies that are specific to those antigens. In other words, if a B cell recognizes the little virus fragment, then it can produce an antibody that sticks to that part of the virus fragment. That's why it's essential for the right B cell to encounter the right antigen. Once this happens, the B cell starts producing large amounts by matching antibodies to help neutralize the virus. It produces a lot more of the same B cell, so it can produce more antibodies to neutralize the virus. Similarly, you have T cells, and T cells recognize the viral fragment similar to B cells and multiply rapidly. Unlike B cells, which rely on antibodies, certain T cells directly kill infected cells and stop the virus from spreading. So I think an analogy is going to be useful here. I remember when learning about this initially, it was all very confusing to me. So I think this analogy might help clear things up a little bit. So imagine your body is at a war. You send out scouts to gather intelligence on the enemy, collecting pieces of armor, flags, or insignias. A scout brings back an enemy flag and presents it to a room full of soldiers. Most of the soldiers don't recognize it, but one of them does. He exclaims, "I know exactly who they are and how to defeat them based off of their flag." This soldier then designs a special weapon that works only against this particular enemy. So in this analogy, the scout is the macrophage. It brings back the piece of the virus. The enemy flag is the antigen, which is the little piece of the virus that the macrophage brought back. The soldier who recognizes the flag in this example is the B cell, and the special weapon that it makes is an antibody. But B cells aren't the only ones fighting here. There's another type of soldier in the room, one who has been trained specifically for close hand-to-hand combat. Once the enemy is identified, he stands up and says, "I've been trained to take down this exact threat." He doesn't just make weapons, but he goes out and directly engages the enemy, attacking and eliminating them. This soldier represents the T cell, which doesn't rely on antibodies, but instead directly kills infected cells to stop the virus from spreading. Just like in battle, once the right soldiers are found, more of them are trained and deployed to fight, just as B cells and T cells multiply once they recognize the pathogen. This is the basic gist of how the adaptive immune system functions. The beauty of it is that it can adapt to different infections and be effective at eliminating them. Another cool aspect of the immune system is that it remembers previous infections. So if it sees the same infection twice, it can more effectively and quickly neutralize it. This is, in a gist, how your body fights off infections. Sometimes this can take days or weeks depending on your immune system, but it generally does a very good job. This is the complicated cellular part of the immune system, but your body does other things to help rid invaders. Some of these things being somewhat unpleasant. For instance, you can get a fever when you're sick, you can cough, produce a lot of mucus, and be congested. None of these are particularly pleasant, but they do all help to fight off an infection. A fever will increase your body temperature, which not only makes it harder for the infection to survive, the actual viruses to survive, but also helps the immune cells work better. The immune cells work better at slightly higher temperatures. Your cough and production of mucus try to rid the body of the infection. You cough out the viruses, you produce the mucus to flush out all of the viruses. The cough forces air and mucus out of your lungs, which helps clear the infection, and the mucus traps the viruses, and coughing it up helps prevent them from reaching the lungs. Viruses, as well as your own body cells, are dying in this process, and this produces a lot of debris, the actual bodies of the viruses, the cells of your body, and all of that has to be removed. Your body gets rid of this over time by flushing it out with mucus and coughing it up. It's like a trash day after spring cleaning. Buildup of immune cells, dead viruses, and the like can also cause inflammation, as well as swollen lymph nodes. These things actually collect in your lymph nodes, which is why they swell up. These symptoms may not be pleasant or comfortable, but all that is to say that they are signs that your body is fighting off the infection and your immune system is doing something about it. Naturally, some things impact how well your immune system works. Individuals who are immunocompromised, such as those with AIDS or type 1 diabetes, have a much more difficult time fighting off infections. There are also comorbidities beyond being immunocompromised that impact how well you fare with a cold, COVID, or the flu. Asthma, chronic lung disease, diabetes, type 1 and type 2, mental health conditions, obesity, physical inactivity, and smoking are all comorbidities that make something as simple as the common cold a little bit worse. For this reason, it's important to take getting sick more seriously if you are immunocompromised or have underlying comorbidities, and to try to prevent getting infected in the first place. Another common question with regards to the common cold is, why do we not have a cure for it? As I mentioned above, antibiotics do not work since viruses are not bacteria. And unlike the flu or COVID, we don't have any specialized medications or vaccines for the cold. The issue is that viruses often mutate and change too quickly to come up with a definitive cure. Furthermore, there are multiple strains of a virus. Think about different COVID strains. This also makes it difficult because there isn't just one target. Contrast this with bacteria, where many of them share similar features that can be targeted. For instance, if you have strep throat, the bacteria that causes this is one bacteria, and it doesn't change a whole lot as time goes on and with future infections. And these features that don't change very much are very good targets for antibiotics. The issue with the virus, of course, is you get infected with a virus and they multiply so quickly that you have these little mutations in their DNA or RNA, which is like DNA. They have multiple forms of genetic material. And these little changes can make them resistant to treatments. And because there's so many of them multiplying in such short periods of time, it's very difficult to target them at all. All that said, we do have some over-the-counter treatments and medications for the common cold that work to varying degrees. Furthermore, there are things that you can do to take care of yourself if you have a cold to recover quicker. Now that we've got the science side of things covered, let's see what to do if you are sick and why the things I talk about work. This is the good stuff. This is probably what you're here for, your one-stop shop for cold remedies. First things first, get some rest. Get a lot of sleep, be a couch potato. Resting and not exerting yourself is very important because it helps your immune system function a lot better. If you're exerting yourself and spending energy on other things, that energy isn't going towards your immune system. This is very important because at the end of the day, it really is your immune system that will eventually clear the infection. So you have to give it every opportunity you can. This is kind of par for the course, though, given that most people don't really feel up for much except resting when sick. But if you're like me and you hate being cooped up inside and laying in bed all day, try to take it easy and not push yourself too much. Some light exercise is likely okay, so long as you don't have a fever and your lungs feel clear and like you don't have to really strain yourself super hard. So going on a walk, or I've been sick before and done some light weightlifting workouts. Stuff like that is probably okay as long as you're not too sick. Next big one is hydrate. Being hydrated is so important as a general rule of thumb as well, but especially so when you're sick. When you're sick, and especially when you have a fever, your body uses up more water. Your immune system also needs more water than normal to fight the infection. Drinking enough water helps fuel this. Furthermore, water will help with headaches, which can be common with colds. Finally, being hydrated can help thin out the mucus that you are producing, making it less likely that it'll get stuck and accumulate in your lungs and your throat and in your nose. This can actually be rather important because thicker mucus can accumulate in your lungs, and this can increase your risk of further infections like pneumonia. In terms of how much water, it's recommended that you drink around 10 glasses per day. Furthermore, you can also drink water from other sources like tea or chicken broth, something like that. Soup is a great option to increase your fluid intake. It won't cure your cold, as many like to claim it does, but, a nice warm bowl of soup can help you drink a little bit more water, and it just tastes nice and it's calming. So definitely have soup, but probably won't cure your cold. Hot showers and humidifiers can also help clear this thick mucus that accumulates in your lungs. And the best way to gauge how hydrated you are is by looking at your urine. If you don't urinate that much, and if it's dark colored, you're probably dehydrated. You want your pee to be a pale yellow color, and this is going to indicate that you are sufficiently hydrated. Honey is actually a common treatment for the cold, but is it worth the hype? And indeed it is. According to a meta-analysis, they looked at 14 studies and concluded that honey improved cold symptoms, cough severity, and cough frequency. So honey is certainly something that you should add to your pajama dawn trip to the store when you're sick. In the vein of foods that you should be putting in your body, you should also avoid salty foods, sugary drinks, and, of course, alcohol. Probably shouldn't drink when you're sick, right? While researching this episode, I was combing through a lot of different treatments and remedies and such for the cold, and I found a very interesting study that talks about a method for reducing viruses by over 99.99%. The study investigated multiple methods of gargling and gargling mouthwash to see how well they killed COVID. They found very significant reductions in viral concentration with mouthwashes that contain cetylpyrrondinium chloride and hexatinine. So 2 mouthwashes that have these are Colgate Plaques mouthwash, as well as a mouthwash by the brand of Cepacol. So look for these 2 chemicals in the mouthwash. I'll say them again: cetylpyrrondinium chloride and hexatinine. These kinds of mouthwashes are often advertised as antibacterial mouthwashes, but this study seems to show significant promise in antiviral action as well. So next time you get sick, again, try to find a mouthwash with either the 2 chemicals, cetylpyrrondinium chloride or hexatinine, as they may be rather beneficial. Speaking of gargling, what about the classic saltwater gargle? The previous study that I mentioned did not find saltwater particularly effective as an antiviral. That said, other studies have found saltwater gargles to alleviate symptoms and even prevent upper respiratory tract infections. So given this, it seems like a saltwater gargle is certainly worth your time, especially given that it's practically free. The next cold remedy is one that's kind of a hot topic, and that's vitamin C. If you go to the cold and flu section of your local drugstore, you will be flooded with vitamin C supplements with a gram or more, sometimes 4 or 5 grams per serving. Alka-Seltzer, Emergen-C, Airborne, they all have it. And it's probably safe to say that most of us have taken it at some point for a cold. However, the evidence regarding vitamin C leaves something to be desired. A meta-analysis and review of vitamin C by Cerullo and colleagues found that, and I quote, "After decades of investigations, the scientific community established that a high intake of vitamin C is useless in preventing the common cold." The key word here is preventing, though, because that said, the study did find that vitamin C may be more effective in individuals with comorbidities, hospitalized individuals, and people who are under high stress, such as athletes and military. And it was mainly postulated in that study that for the general population, it's not very effective at preventing the common cold, so taking it every day hoping you won't get a cold. However, another meta-analysis by Rand and colleagues found that, and I quote, vitamin C is capable of relieving chest pain, fever, and chills, as well as shortening the time of confinement indoors and mean duration. So they propose that vitamin C likely works because it's highly concentrated in the immune cells. So if you can replenish this, the idea is that it helps the immune cells work better. And as you are sick, the concentration of vitamin C decreases. So again, replenishing it is kind of the theory of why it works. So what does this all mean with regards to vitamin C? Should you take it? Should you not? Is it worth it? As far as I can tell, vitamin C is still worth considering because it may decrease the duration of the illness and help with some of the symptoms. As far as dosages go, 1,000 to 2,000 milligrams a day is safe for most people, and loading up early in the cold can be beneficial. So when you start to feel the symptoms coming on, loading up on the vitamin C may provide some benefit. However, I also don't think it is a silver bullet in terms of treating the cold. So it may help some of you, probably worth trying. You can't really overdose on it or anything. It's a very safe supplement, but I probably wouldn't hold your breath for it to do much. Another often suggested supplement kind of in the same vein is zinc. Zinc is in a similar boat as vitamin C, it appears. Studies in the 80s found that zinc can prevent some viruses from getting into your body's cells. However, this hypothesis has not been totally proven. In terms of whether or not zinc helps for a cold, this is what one meta-analysis found. According to Nault and colleagues, zinc had little to no effect in preventing colds. So similar to vitamin C in this regard, if you take it every day hoping you'll never get a cold again, probably not the case. However, they did say that zinc could reduce the duration of a cold. A caveat here, though, with zinc is that some people did experience side effects like an upset stomach, mouth irritation, and diarrhea. So a little bit more caution is advised in terms of how much you take, because with vitamin C, I didn't really find anything with regards to negative side effects. But with zinc, because there are the side effects, you want to be more careful with the dosages. And in terms of dose, they recommend in these studies that you should keep it to less than 40 milligrams per day. And a common form that they looked at in the studies was throat lozenges or oral zinc supplements. So perhaps it may help. However, with anything, it's a good idea to check with your doctor and make sure that they recommend that it's good for you. But I think for most people, again, kind of like vitamin C, probably worth giving it a try. Don't hold your breath. It probably won't do much according to the studies. It may shorten the duration of the cold, but that seems to be about it, as far as I can tell. And big organizations that I read into, like the Mayo Clinic or Harvard, kind of agree that zinc probably won't do much for the common cold. Moving on, one tool I personally find very helpful when I have a cold is a neti pot, or I don't know what it's called. It's like the one that you squeeze. It's the neti squeeze thing. And some of you will have used these. Neti pot is basically a tool you use to clear your sinuses. You fill it up with water, distilled water, filtered water, or sterilized water, and you put a little salt packet in, and you basically flood and flush out your nose with this water, and it clears all of the mucus and boogers and all that gunk up there, which personally I think really helps clear the sinuses, and many other people think so as well. So the neti pot is rather effective at clearing all this mucus and such from your nose when you're sick. This can help congestion as well as allergies during an allergy season, which is nice. And there are a few things to note. Like I said, you want to use distilled, sterilized, or filtered water. This is just to make sure you don't get any contaminants in there that could get into your nose and possibly your brain. Your brain is in very close proximity to your nose, so making sure nothing funky gets up there to get into your nose or brain is important. You want to use clean water. And you're good to use it a couple times a day if need be. You shouldn't use it, though, if you have clogged ears, if one of your nostrils is totally blocked off, or if you've had recent sinus or ear surgery. But all in all, this option is very safe. Granted, you use clean, distilled, filtered, boiled water, whichever one you choose. And I think it can provide some relief during a cold. So I also want to quickly go over some of the over-the-counter medications that you can use. One note with all of these is to follow the recommended dosing on the package. Though these drugs are over-the-counter, you still need to be careful and not take too much. So the big ones here, I think, are pain relievers, Tylenol, Advil, or acetaminophen and ibuprofen, respectively. They can help in reducing symptoms like body aches, fever, and headaches. Antihistamines are also useful. This is going to be something like Benadryl. They can help block histamines, obviously, and histamines are the little chemicals in your body that cause runny noses and sneezing. Benadryl can also make you sleepy, which is probably helpful if you have a cold as well, since sleep is very commonly affected when you're sick. Cough suppressants are also very nice if you have a cough. These are going to be dextromethorphan and guaifenesin, and they stop a dry cough and thin out mucus, respectively. Finally, you have nasal decongestants. These drugs will help open up your nasal passages. This is going to be something like Sudafed or Afrin, which is the nasal spray version. These last ones, I think, should be taken with a hint of caution, though, because they can cause something called rebound congestion, which is where you use the medication, either the Afrin or the Sudafed, your sinuses open up, and then once it wears off, your sinuses close off. So you use it again, and you're just in this cycle. And then even after your cold has passed, your sinuses can keep closing off, and you would still basically need to use the medication to open them up again, or you could just stick it out and wait until they open up again on their own. So they can be a little dicey in that regard, especially the Afrin nasal spray. So just a word of caution with those. Finally, I'm just going to rattle off a couple of myths about treating a cold that just don't work. You don't get colds from the cold. You get it by being exposed to a virus. This one's ridiculous. Putting Vicks Vapor Rub on your feet. Some people think this works. It won't do anything. Sorry to say. Some people think eating dairy products during a cold should be avoided. This isn't really the case. Dairy won't negatively affect your cold, so have as much dairy as you like. And then cold compresses and cold baths are something some people do to try to bring the fever down. They won't do this. A cold compress will probably feel nice. I don't think there's anything wrong with using it. It just won't bring your fever down. And then the cold bath is probably something you should just avoid altogether when you have a cold, just so that you don't mess your body temperature up too much, as you're already in a bit of a vulnerable state there. So cold compress is probably fine though. Feels nice, probably won't do much. All right, I think when talking about the common cold, there is a lot that people could use a frame shift on just to make it more understandable. As I mentioned before, I'm going to say it again, antibiotics won't do anything for a cold. Getting ruled out for a bacterial infection is really the only way to see if you need antibiotics. COVID and flu also have medications, but like antibiotics, you need a positive test, and if you don't have them, then the medications won't work. So no antibiotics for a cold. Make sure you get tested if you're uncertain, but if you're negative for everything, you just have to stick it out and do some of the things I've mentioned today. In terms of preventing a cold, there are some things you can do. Practicing good hand hygiene helps. So washing your hands after being out in public and not touching your face or mouth. These are very good. Using hand sanitizer, that sort of thing, just to make sure you don't have any bugs on your hands. Having a healthy and balanced diet, as well as regular exercise, will help bolster your immune system as well. Sleep is another big one, especially when you're sick, but also when you're not sick. Getting 8 to 10 hours a night. Some sources say 7 to 9 hours. Different people have different amounts of sleep that they need, so figuring out how much you need is going to be kind of individual. I'm going to do a whole episode on sleep at one point, so hang tight for that if you want to know more about sleep. And trying to reduce stress can also help your immune system as well. Like I said earlier, staying hydrated is always good for your body, regardless of if you're sick or not. So even if you're not sick, drinking a lot of water every day is really good. And doing all of these things when you're not sick is just going to help reduce the odds of you getting sick in the first place. And if you do happen to get sick, it'll probably make being sick a little bit better compared to if you didn't do these things. I personally get sick with a cold like every year. I feel like every year I'm getting a cold and then COVID. I get sick a lot for whatever reason. This may be due to my immune system, but It also probably has something to do with the fact that I work in healthcare. And whenever I get sick, be it with a cold or flu or COVID, I always tend to reflect on my health a little bit. This is another kind of frame shift way of thinking about being sick, perhaps. And being sick, it's unpleasant. It can impact your life significantly. If only for a few days you miss work or school, you feel crappy. But even though I want to get better as soon as possible and get back to my life, I do actually find some good to come from being sick. Now, I know this sounds a little weird, but let me kind of explain. So whenever I'm sick, I always have like this moment where I'm laying in bed, I'm probably not sleeping, I feel like crap, and I just wish I could just snap my fingers and make myself feel better. And then I start thinking, I do feel good most days. And most days I don't even think twice about it when I lay down to bed and I'm not having trouble sleeping, my nose is open, I'm not coughing. I don't have body aches, fatigue, a persistent cough, etc. most days. And framing a cold in this way actually gives me a great deal of gratitude for the times when I am healthy. And when I am healthy and feeling unmotivated, I can use it on occasion to think back to when I'm sick and realize how unencumbered I really am when I'm healthy. The main point here is that I find gratitude to be a huge virtue. It's something that I think is very important in life. And when I'm sick, I can almost use that as a touch point when I'm healthy to be like, okay, I have a lot to be grateful for right now. I'm not sick right now. And it just gives me an awareness of the opportune position I'm in when I'm in good health. So gratitude, like I said, is a virtue that I think often goes overlooked. But if you can alchemize it, if you can find a way to be grateful by comparing prior hard times, like being sick, to where you are right now, I think it can shed some light. Being sick also reminds me of the importance of staying in good health in general, because if you start to have health problems, especially chronic health problems, a big barrier to overcome has been introduced in your life. And when I'm sick, I'm reminded of this. When I'm sick, I think, oh my God, I'm so happy that I don't feel like this every day. I'm going to continue to make sure that I stay healthy so that I don't develop a chronic condition, or do as much as I can to prevent against developing a chronic condition so I can continue to feel healthy and good most days. And being healthy just negates the need to be encumbered by all the obstacles that present themselves when you're not healthy. I guess my point here is that even though being sick sucks, there's still some opportunity for good if you can use it as an internal reminder of gratitude and a motivator to stay healthy. Nobody enjoys getting a cold. The poor sleep, missing work or school, that damnable cough that just won't go away. Thankfully, there are some things you can do to help your immune system fight off the infection. We may not have a cure for the common cold, but your body is indeed an excellent marvel that can use war tactics to fight off the invaders that are viruses. Helping to prop up this internal army can aid in the cause of kicking the cold quicker. Resting, staying hydrated, eating healthy, as well as some novel treatments like over-the-counter meds, mouthwash gargles, and a neti pot can help with symptoms and perhaps decrease how long you are sick for. And even though being sick sucks, it gives you a temporary vantage point from which to be grateful for the good times when you're healthy, and a reminder of how important health is to feeling good and making the most out of life. Well, I thank all of you for listening today. I know it's winter time and a lot of people are getting sick. I'm just overcoming a sickness, like a little cold myself. So I've really enjoyed making today's episode given that. And if you enjoyed it as well, make sure to share the podcast and follow the channel. It helps a lot. And like I said, as always, I'll include sources and further readings in the show notes. Thanks again. I hope all of you have a great one, and I can't wait to see you for the next episode.